Hi, my name is Nana Lau and my partner is Hugo Vega. Welcome to a presentation on the financial management of a nursing unit. This is for City University of New York School of Professional Studies, Nurse 602, Healthcare Finance with Dr. Ann Simmons. Good morning. This is our agenda today, which is unit overview, questions, answers, challenges, strategies, and preferences. Our unit of choice is the spinal cord unit at B Rehabilitation Hospital, which is a nonprofit institution with 5 nursing units. The spinal cord unit has 30 beds with an average occupancy of 21 patients, 66 total capacity, and with an average hospital stay of 14.7 days. Some of the disease diagnoses that our patients have are spinal trauma, chronic inflammatory demyelinating polyneuropathy, CIDP, amyotrophic lateral sclerosis ALS, spinal cord compression transverse myelitis, paraplegia, cardiac patients, and ischemic diseases. Our interview took a format of 3 interviewees because the nurse manager did not have much financial oversight. Our facilities reporting structure is the nurse manager. She handles the staff education, hiring, and retention of nurses. The chief nursing officer, the CNO, oversees day-to-day nursing, staffing, and general budget management. And she or he reports to the chief financial officer. And the CFO handles the hospital's overall budget, revenue collection, and resource distribution. Our interview questions were directed one per person. We start with the nurse manager. What are the main challenges in staffing? The chief nursing officer. How is the budget for the nursing unit developed? And the chief financial officer. What strategies increase the hospital's revenue? We asked our nurse manager what are the challenges in staffing, and her answer was staffing is very challenging as there is a chronic RN shortage where each shift is frequently short-staffed by 1 RN, and hiring retention is another challenge as frequently hiring involves interviewing a large amount of RNs and only a small select number are selected and given an 8-week orientation with an average retention time of 6 years. In the interview answers for the CNO, we asked her, how is the budget for the nursing unit developed? And her answer was that the staffing ratio is guided by the patient acuity, average daily census, and staff expertise, with an RN day shift ratio of 1:8 and night shift ratio of 1:9 patients, and a nursing assistant day ratio of 1:5 and nursing assistant night shift ratio of 1:6. And supply and equipment needs are projected based off historical records from data from the statistics department. In our interview with the CFO, Chief Financial Officer, what strategies do you use to increase the hospital's revenue? He answered that Hospital B has formed affiliations with major hospitals, and they use quality metrics to increase reimbursement from Medicaid and Medicare. Some of the challenges faced by our 3 interviewees are the nurse manager's challenges is with nurse scheduling, hiring, retention, and RN shortage. The chief nursing officer has challenges with balancing the staffing ratio and equipment needs within the allocated budget, along with improving quality metrics and also how to capture the quality data metrics for reporting. And the chief financial officer's challenges increase hospital revenues and payments, and also how to use quality metrics to improve reimbursement from payers. Strategies part 1 of 2. For the nurse manager, some of the strategies we came up with to address her challenges of scheduling is self-scheduling, retention, recruitment, and hiring bonuses. For self-scheduling, according to a poll from the American Nurses Foundation, about 66% of the nurses reported being satisfied with their employer's flexible schedule options, and nurses of all tenures identify self-scheduling as the most important flexible scheduling options to them. The highest desire for self-scheduling came from the new nurses, 41% per Becker's Hospital Review. And for retention and recruitment, it requires a balanced approach involving more than just staffing. Nurses need resources, professional growth opportunities, psychological safety, teamwork, and a supportive work culture. Addressing these factors is crucial for retaining nurses, as per Lakowski-Jones. And also in the use of LPNs in the staffing skill mix, according to Yang, nursing homes emphasize LPN in place of either RN or CNA care appear to exhibit higher rates of unplanned rehospitalization and ED visits amongst the residents. So our evidence does not support the use of LPNs in the staffing mix. And for our CNO, balancing staffing ratio and equipment needs with an allocated budget, CMS issued a final rule on 4/24/24, finalizing a total nurse staff standard of 3.8 hours per resident day, which must include 0.55 hours of direct nurse RN care and 2.45 hours of direct nurses aide care. Facilities may use any combination of nursing staff, RN, LPN, and nurses aide to account for the additional 0.48 hours needed to comply with the total nursing staffing standard. This is from the CMS. For the CNO to advocate for adequate RN staffing to increase quality metrics, as per JAMA, this study suggests that holding average staffing levels constant, day-to-day staffing stability, especially avoiding days of low staffing of licensed practical nurses, certified nurses, is a mark of better quality of nursing homes. Our strategy part 2 of 2 for the CNO, Chief Nursing Officer, to implement quality improvement projects to improve quality and therefore reimbursement. According to the Agency of Health Care Research and Quality, AHRQ, it is noted that producing high quality care may allow nursing homes to become more efficient, or may allow nursing homes to have higher revenues due to higher quality, which can ultimately improve financial performance. This is per Weech. And according to the National Database of Nursing Quality Indicators, AHRQ has 4 indicators: the prevention quality indicator PQI, the inpatient quality indicators IQI, and the patient safety indicators PSI, and the pediatric quality indicators PDI. The strategy for our CNO which is to design education for staff that focuses on quality and metrics and reportability issues, and to use automation technology to capture these metrics. Per Johns Hopkins Fall 2021, the Nursing Professional Development and Education Department held a 2-day nurse-sensitive indicator fair to reinforce the ongoing day-to-day work of NSI, Nursing Sensitive Indicator Reduction. Some of the activities included stations and educational content about available tools and processes for every critical indicator, such as falls, CAUTIs, HAPIs, and CLABSIs. The NSI Education Fair gave the nurses an opportunity to reemphasize the importance of these indicators and for keeping their patients safe, and help them create a linked success in these areas to the culture of nursing. This is per Johns Hopkins. Our strategy for the Chief Financial Officer of forming affiliations with major hospitals for referral and payment negotiation with insurance and payers, according to RAND, These new software forms of vertical consolidation are emerging that are largely invisible to policymakers. Hospitals form clinically integrated networks, allowing their healthcare systems to expand and increase the flow of patients to the health system to garner more revenue and to allow previously independent hospitals and providers to provide higher quality care with higher payment rates negotiated by the larger hospital system with insurers. And our second strategy for our CFO to increase Medicaid, Medicare payments with quality metrics and grants, per CMS, they tie payments to quality metrics. At the state levels, quality measures are used in many state initiatives, including New York's Prevention Agenda, which is New York State's blueprint for state and local action to improve the health of New Yorkers and to reduce health disparities for racial, ethnic, disability, and socioeconomic groups. Several of these initiatives involve the use of quality measures at a healthcare system or at a practice level. Aligning health quality measures using these programs as well as value-based programs create synergy in effort and reduces the cost and burden of collection. This is from CMS. And this is our reference page that includes all sources used for the above presentation. Thank you very much.